daily. Title of my speech is Dying with a Cause. Okay. I met one of my dearest friends in 2005 in Springfield, Missouri. She has a daughter with the same name as my oldest daughter, same age, and she has a son who's 1 year older than my youngest daughter. We both became pregnant with our third child 6 weeks apart. Unfortunately, my pregnancy was not a healthy one, and I lost my baby at 14 weeks. Her baby went on to live a normal and healthy life until November of 2017 when she received the diagnosis of osteosarcoma. Her baby lived until March 15th, 2018, 2 months shy of her 11th birthday. Most people don't even know what osteosarcoma is, even though it is the most popular, that's the correct word, cancer for children, bone cancer for children, and is number 3 in pediatric cancers across the board. It attacks the long bones, which would be the long femur, shin bone, and the bone from the shoulder to the elbow. It is usually caught during a growth spurt. Statistics of osteosarcoma are normally the patients are 10 to 20 years old. It is very uncommon for a child 5 or under to be diagnosed with this. It's usually because it usually does happen during the growth spurt. 400 children between the ages of, or under 20, between the ages of 10 to 20 are diagnosed every year with osteosarcoma. It's the 3rd cancer in teens after lymphoma and brain tumors. Lizzie was diagnosed in November 2016 after complaining that her knee hurt. Her parents thought it was a growth spurt. But after simple activities like playing basketball with her brother, she would come in complaining constantly that her knee still hurt. So they took her to the pediatrician, who thankfully ordered scans and determined that she needed to see a specialist. She was diagnosed and immediately flown through the hospitality of their friends to St. Jude's in Memphis. Treatment is dependent on the stage at diagnosis. The most common treatment is surgery. According to curesearch.org, before 1970s, amputation was the only solution. Now, with artificial limbs, we can do chemotherapy, and then if the cancer is contained, they can put an artificial joint in. Hip, shoulder, blade. In Lizzie's case, it was her knee and part of her femur. Then they follow up with chemotherapy because the reoccurrence rate for osteosarcoma is so high, and it is very difficult to treat and reoccurring. There's only a 30% success rate if the cancer is not contained. There's a 70 to 75% success rate if it is. Also, clinical trials are sometimes used. St. Jude's has created more clinical trials than any other children's hospital in the U.S. The Mayo Clinic is the first to complete an American study in February of 2002 using samarium for treatments. And they published their findings in the Journal of Clinical Oncology. Another great program right now is at Memorial Sloan Kettering. They're currently conducting 6 different clinical trials specifically for osteosarcoma. Unfortunately, Lizzie did not qualify for a clinical trial. There is such a high reoccurrence that follow-ups are always recommended. St. Baldrick's Foundation recommends that the first 1 to 2 years after treatment, you go every 4 months, 5 months after the 3rd year, 6 months in the 4th and 5th year, and then annually through the adolescence. A treatment or a follow-up appointment would include a physical exam, imaging of the lungs, where tumors usually originate after a cancer survivor has had chemo. There's often other forms of cancer that sometimes are a complication due to that. And they go to the lungs. So they scan the lungs. They have to monitor their heart, liver, and kidney function. There's usually hearing loss during treatment. Hormone levels, cholesterol, and bone density all have to be monitored. Lizzie was accepted to St. Jude's immediately. She started a treatment plan that unfortunately had not seen any new protocols in over 40 years. A very small portion of cancer research funds goes to pediatric cancers, and less than 2% of that goes to osteosarcoma. Her treatment included chemotherapy, her surgery to replace her knee and part of her femur, and then more chemo after the surgery. It was considered a success. She had several follow-up scans. Everything was clear. In August of 2017, they were planning her no more cancer, no more treatment party. One final scan, however, revealed that there were tumors, new tumors in her hips and her other leg. Finally, after more treatment was ordered, very exhausting treatment, December of 2017, the panels of doctors treating Lizzie sent her home to be comfortable, to try to make memories while she had the opportunity. Unfortunately, there's a huge emotional toll in life after osteosarcoma. If the person with the disease does survive, it's usually with a loss of limb or artificial joints, which means they can't do things that most kids do, like play basketball, sports, dance, ice skate, those types of things. If they do pass away, their siblings have often been forgotten. They're usually referred to as the forgotten children because the priority is on the sick child. Parents have to go back to a life without one of their children, trying to raise the remaining children, returning to jobs, returning to careers in what they call normal life, if there is such a thing after the loss of a child. The child that does survive has seen friends that they've made during the treatment. Treatments are sometimes months, occasionally years of battling this disease, and they've lost friends while they're in the hospital and in treatment themselves. Finances are impacted. These hospital stays go on for months minimally, often years. If they are not fortunate to get into a clinical trial or a hospital like St. Jude's, they have hospital bills. Most of their savings, 401ks, retirement plans, have gone to paying their mortgages and their car notes. So it is pretty traumatic. What amazes me is that most choose to join the fight. Lizzie, this is Lizzie at the time of the diagnosis. She decided to, at the end of her life, to donate portions of her tumors to St. Jude's research. She told her mom that she never wanted another child to have to suffer the way that she suffered during her cancer treatments. With her generosity, it is currently being researched in 5 different countries. Her parents' charity, Lizzie's Walk of Faith Foundation, has given back to kids and families in St. Jude's right now, fighting the good fight. They do a marathon, just like St. Jude's does a huge marathon every year. Many people join in that. They do a smaller version of that in their hometown. This last year, they presented a check for $30,000. They give financial gifts to people in the fight. There are several organizations that you can be a part of that do the same thing. On a visit to St. Jude's, her mom and sister were fortunate enough to meet with a researcher who was showing them some of the advances they've made in screening for cancer. So I have a short little video here to share with you.
And the amount of color that you see, so the more kind of red that you see, the more tumor cells that were killed. So red and yellow, that means very little cells. If there's lots of blue, that means lots of cells were still living. So if I were going to test a treatment and say I put 96 different treatments in here, right? I want to go look and see, hey, what are in these red wells that actually killed all these tumor cells? What drugs are those, right? And then you take something like this.
And recording, so.
Yeah, that's fine. So this here kind of matches up to what a 384 well plate would look like, right? So if I wanted to look, I have a computer program that will tell me, and unfortunately, what happens when you're trying to look for new therapies for cancer cells, you see a lot of blue. A lot of them don't work. So I would look under the microscope and I would see lots of cancer cells are still alive. That drug didn't have any effect. But then I'm like, wow, that's interesting. Like, what drug is over here in space, N20, right? What drug caused all these tumor cells to make this red where all those tumor cells died? Or what's this yellow box here, M12, right? What drug is that? And then how does that look if I look at, 3 or 4 or 5 different osteosarcoma samples? Does everyone have this yellow spot at M12, or does everyone have kind of these red spots? What drugs are those that are working? And so that gives us a hint, right, of what's happening, where we can identify drugs, just by looking at them under the microscope and kind of what the cells are doing when they're being exposed to those particular drugs, that we can take those drugs and then do further testing, right, to try to validate these findings. So that's one of the things that we're able to do. Again, 384 combinations at one time. Imagine a stack of 10 of these plates. That's 3,000 drugs you could test. Much better than the one that I could do at a time.
I think one of the reasons that osteosarcoma, it is so important to find a cure, and anyone involved in the research is so passionate about it, is that if you were to press your hand on the soft tissue around your bone, you see that there's give. Well, osteosarcoma literally turns that soft tissue into hard bone. And so when they sent Lizzie home, drop my picture, she literally became like a living China doll. Everyday tasks, like going to the restroom, became very dangerous. She chose not to let this disease define her life. She shared joy every opportunity that she had, and she decided to give back so that no one else would have to suffer the way that she did. I hope that at the end of my life and at the end of your life, we can look back and know that we did something bravely, like Lizzie, and that we shared joy and had purpose even in our pain. Thank you for allowing me to educate you. I hope you found this not only educating, but inspiring to live the most of your life each day, to not take for granted the health that you have, and to be brave and do whatever you have in your heart to do. Thank you.